Hello everyone, once again welcome to my IT channel. So I'm going to start a few sections of works in nursing home in Ireland so that those who are intended to work in Ireland or those who are planning to apply to Ireland as a nurse in nursing home, you may get some ideas. Okay, the first thing, like we should not call them patients. So the term is resident in Ireland. The term patient has been changed to resident. So it may be difficult for us to like familiarize with all their preferences, especially the names, the terms, and everything. The first thing you have to just keep it in your mind to call them resident. Okay, so just to exclude the term patient. The next thing, it may be small homes or bigger homes, whatever. There will be some rules and regulations like wing wise, like wing A, wing B, wing C, or it's like first floor, second floor, or whatever. When you give informations to relatives, so the relatives usually known as NOK, that is the next of kin. So we will not call like relatives here, it is NOK. So usually next of kin. They may son, daughter, nephews, nieces, or sisters, brother, or whatever. That maybe if they don't have any relatives, sometime then okay, maybe the solicitor. Okay, it's not next of kin solicitor. Solicitor means it's a lawyer. Okay, so like the legal rights, they have the legal rights to take any decision regarding those residents, like medically, financially, or whatever. They are not NOK, but they are the concerned person. So always when you work in the nursing home, you have to identify the residents. We are not going to call them exactly with their name. Okay, so we have example, if you have Elizabeth, most of the term Elizabeth or the name Elizabeth, they have nickname Lily, okay, or Betty. So in a nursing home we may have 5 or 6 Elizabeth, and their nickname might be the same. So that is the first thing, you might have difficulty to learn their names, especially the nicknames. So they don't want to, they won't prefer to call their original name, especially they need like nicknames. So that is the thing you have to be familiarized. The next one, the families. Who is the NOK? So you have to familiarize with everybody, those who are the first NOK. Okay, in case if anything happened, or in case if anything, to whom you have to call or you have to inform them. So everything will be there in your system or in the file whom we have to inform. But personally, it is always preferable to have in your mind, so who is the best person to inform regarding this resident. Okay, so this is regarding the personal things. The next thing, you have to be keen to know their likes and dislikes. So it will take like a few months to year to know completely their likes and dislikes. Of course, in every nursing home there might be activity coordinator, so they are the one is closely monitoring or closely dealing with the residents and their families. So if you have any doubts, you can just ask them, you can get the information from them, like their usual likes, dislikes, what they need, what they prefer, where they are to sit. Some of them, they need to sit in their room itself, they never come to the common communal areas or dining area. Some of them, they want to sit in the garden for a few hours. Some of them, they need to read books in some air, or somebody, they need daily newspaper. And some of them, like they just want to go out with the family, like at least weekly once. Some of them, they are more spiritual, they just want to spend time with the Holy Bible, or see mass in telly and everything. So like personal things, like personal preferences, you have to know. If you know their personal preferences, it is easy to deal with them. Okay, so it's not a hospital, so it's look like a home. Actually, it is their home. The nursing homes are really their home. And so we could not give like 100% homely atmosphere. However, we can provide or we can facilitate such a situation similar to their home. And some nursing homes are dementia specific. They have only dementia residents, so their memory power, it is impaired. Dementia is not completely dementia. You could not think that dementia resident means they could not remember anything. Like they can recognize their family, they could remember their old memories, they could remember old like events, and still they can continue their hobbies and everything. But the memory is not intact. Okay, so somewhere they could not think properly, they could not take like decision, or they could not actively participate with the decision, like legal decisions, or sometime they will not be oriented with the date and time, but they could they knows that they are in this nursing home for this many years, or it's not their home, something like that. For some residents, few of them, they might have a severe cognitive impairment, so they may not knowing that where they are, but still they could communicate with us. They can tell their preferences and everything. So dementia, it is a complex thing. We could not completely tell that the residents could not remember, or they could not actively engage with any activities. So we have to know each person, whether they are like they have mild cognitive impairment or moderate or severe, whether they can understand or whether they can give their own suggestions. So those who can give more suggestions regarding their care and everything, so we have to include them for providing care, especially the simple thing. When they are the carers, they are giving the morning care, they can ask them, which cloth do you want to wear today, or which color of the cloth you prefer. So they could give you the suggestions. Okay, so their likes, dislikes, preferences, everything is important. Especially in Ireland, the culture is somewhat difficult. Not somewhat, it's completely difficult. So we will have the difficulty even for serving tea. Some residents, they prefer like a tray with the milk separate, decoction separate, sugar separate. We have to give cup and saucer like separate. They will prepare themselves. For few, we have to prepare and we can give it. So this is different for everyone. Some prefer to have meals at the bedroom. Some they need in the dining room. Some they need in the like common area by watching telly or something. So it will be totally different. So you have to come to know, you have to know regarding each and every residence where you are dealing with, and the easiest one, you can refer their care plan. Okay, so the care plan reflects everything. You can see their likes, dislikes, their communication, their capacity, their mobility. Some of them, they need assistance of one, some they need assistance of two, some they are completely bed bound, some they are chair bound, some they are like complete mobile but need supervision. So these everything you could see the mobility care plan. Okay, so that's the care plan reflects everything. So if you don't have any other sources, directly you can see the care plan if you are a new staff in any nursing homes. Okay, whenever you are in free time, even in your free time, you can just see the care plan and you can dig everything. Even every staffs, they may not have any like clear idea, but if you can see it in the care plan, the referrals, like medical conditions, the medications, any specific medications, allergies. This is important thing. You have to know who have allergy or who is allergic to specific antibiotics or any other medications. Okay, so this is important. And then one more thing, you have to know who is like who has challenging behavior. The challenging behavior you will come to know when you're working inside the nursing home. Challenging behavior means those who will get agitated or aggression very easily, and you have to be follow their protocol. Okay, before going to give their antipsychotic medications. Um, for every residents, those who are challenging behavior, we can like redirect their mind. Example, we can provide a cup of tea, or we can ask them, or we can move them to different area with low stimuli, and we can just talk very quietly, like in what we can tell, it's like a redirection. Okay, we have to redirect their mind. If example, if they are dementia residents, you can redirect their mind. That's what I told you. You should know the preferred way or preferences, so you can provide that. Some of them, they might be calm with a few person. If they see their preferred person, they might be quiet. Some of them, they need a cup of tea. Some of them, they need a calm environment, low stimuli environment. Some of them, they want to go to their room in case if they are stimulated. So these preferences have to be identified, and you have to keep it in your mind. Okay, the important thing in nursing home is the safeguarding. That is the abuse. You might study these abuses before your interviews. It is much important, safeguarding and abuses. Any type of abuses are not tolerated not tolerating in any of the medical institutions, wherever in the globally it's not accepted. Physical abuse, chemical abuse, like we have financial abuse, institutional abuse, neglect. There are many types of abuses are there, so I will deal in another one video. So this is a simple glance you have to just know before going to work in a nursing home. These every abuses you have to know, you have to report it. If you see any type of abuses in your nursing home, you have to report to your line manager as early as possible, because it's a serious thing in nursing homes, that if there is any type of abuses happens, we have to notify to the authority, like regulatory authority, straight away. Safeguarding team, in case if it is needed, we will inform the police. We'll call garda means it's police. Okay, so there are more formalities, and like the security of the resident have to be maintained. So everything have to be notified and preserved with the staff nurses. So these are the important things you have to keep it in your mind. By next video, I will explain you one by one what are things you have to keep it in mind when you work inside a nursing home. So until then, bye, take care.